Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I'm going to flip the coin. And actually, Nadine Waeghe, who is joining me today, she's a very good friend and physical therapist that I worked with on the tour for many years. And, we started talking about my podcast, it was a couple months ago. And she's like, hey, somebody should really interview you so people know more about you. And I said, that is a great idea. How would you like to interview me? Because you know a lot about me as my friend. And she's like, yes, let's do it. So I'm going to turn over the hosting to Nadine and let her ask me some questions so you guys can get to know me a little bit better and share some of my insights.
Oh, thank you, Lisa. I'm so excited about this because I feel like if I was going to do a podcast, you would be my first guest. So finally, your audience will get to learn a little bit more about you and your background. And through your previous interviews, there's some insight into you, but I think it'll be great for them to learn a little bit more about you. So let's start with the first question and tell us a little bit about yourself and your business, your journey to get there.
Yes, well, it has been an interesting journey. I was thinking about this as I was preparing for my own interview. So what many people may not know is that I actually started out as an X-ray tech before I even got into physical therapy. And I was working in a physical therapy clinic taking X-rays, and I loved medicine. It was, exciting to me. But when you're doing X-rays, it's basically you take the X-ray and you never see the person again. So I, started working in a sports medicine clinic taking X-rays basically for their, clinic that they had once a week. And I started to see what physical therapists were doing. And I was like, I think that I might want to go into this. So I, from there, I started volunteering. I started looking into what is exactly the physical therapists do. And I decided, okay, this is really what I want to do. So I got all my prerequisites. And I applied to Ohio State. I applied to University of Pittsburgh and then in Chicago as well. And I ended up getting into Ohio State and into Pittsburgh and decided to go to Pittsburgh. Now, one of the other things that I wanted to share that happened was when I had to go do all my applications, you need recommendations, right? So I had asked for a recommendation. I'll never forget this. The guy that owned the PT clinic, his name was Lynn Wallace. He's, I think he's passed, he's no longer with us. But so I went to him and I said, look, I'm going to apply to PT school. And I really love a letter of recommendation. And he said, no. He said, I don't think you'll be a good PT. I said, okay. And so I share this story because for anybody out there who's been told they're not good enough, they can't succeed, right? They've been knocked down, instead of letting it knock you down, make it drive you forward. And that's what I did. I thought, I'm going to show you, and I obviously got other recommendations, got into University of Pittsburgh. And, and then, after I graduated, I went and worked in a variety of settings. And I would say for our audience listening, any new grads that are out there, I always recommend go work, even if you're you love orthopedics, right? Orthopedics is always sexy and interesting. And people are like, that's what I want to be working in. But really in orthopedics, you see everything. You and I just emailed you about amputees. I have done amputees years ago, but I haven't done them in a while. So, doing amputees, doing spinal cord, doing stroke, head injured, you get exposure to many different things. And that's what I did. I did home health. I worked in a hospital. I did inpatient, outpatient. And I got a lot of experience, and especially when it comes to neuro, because every orthopedic patient is a neuro patient, right? And so the more experience you have, I think the better off you are, especially if you're going to go into orthopedics. So I just worked in everything. I was even a traveling physical therapist and kind of went all over. And then ended up working in a spine center, the Chicago Institute of Neurosurgery and Neuroresearch. And that is when I realized I had no clue how to treat the spine. And all my colleagues were getting people better. And I was like, how are you guys getting these people better? They're so complicated. And they're like, you have to go to Michigan State. And I was like, okay, what's Michigan State? They're like, you got to go. It's the College of Osteopathic Medicine. There's these great classes. And I was like, all right, sign me up. So I went, I took every class that I could take. Absolutely, like, kind of, that's when I fell in love, with osteopathic, medicine, and just, the power of what it could do. And it really helped me to understand how to treat the whole body. I got great mentors there, Dr. Carl Steele, Dr. Mark Bookout, who, these guys were just, I was in awe of what they could do and how they shared their knowledge. And so after doing just a couple of years of teaching, I was like, or taking the classes, I'm like, I want to teach. I'm like, I know in order to get really good at this, I need to teach. So I started teaching. And then that's where I got introduced to the therapists on the WTA. And they invited me to come and work the US Open. I worked Amelia Island. And shortly thereafter, they offered me a job. That's where I met Nadine, spent 9 years traveling around the world, treating, athletes and, a variety of, conditions, and got to learn really how athletic trainers work. Because you're an athletic trainer. I was not. So when I first went onto the tour, I had to go get my first responder. I had to learn how to tape. I had to learn how to become an athletic trainer versus actually having the training. So it was quickly on the job training, thrown into it. And it was like, okay, ready, go. And, so I did that, up until 2009. And then I started back to normal. And now we have, several therapists. It's a whole body, healing center where, we're not only, helping somebody, get out of pain, but, we're looking at their whole performance and wellness, and how to just maximize their overall health. So kind of that's my history in a snapshot.
Yeah, awesome. I have two questions out of that.
Yeah.
Number one, was Dr. Greenman still around when you started at Michigan State?
Absolutely. So I actually had the pleasure of teaching with Dr. Greenman, and and it was great to be able to, he was the one who had written the books, and it kind of, started a lot of it. And I'll never forget, he used to always say, experts do the basics the best.
Yeah.
And that always stuck with me, right? And it's just like, and I hear the other faculty members and I hear myself saying it, but it's so true. I think as therapists, we're constantly like looking at the next shiny object of like, oh, well, what's this and what's that and what's that, and if you just really learn how to do the basics and you do them really, really good, I think that helps to give us really great outcomes. So that's something I always remember him saying.
Yeah, I totally agree. That's one of the things whenever I get students, whether they're athletic training students or PT students or in any of the sports sciences, I was like, know your anatomy. If you know your anatomy and you understand the way the body moves, you can fix anything, really.
Yeah.
So,
Yeah.
similar to just that mechanics of the spine, it's a little bit more detailed to get to the basics. But once you have it, 90% of my clients, I don't pull out any of my fancy tools or techniques. I
Yep.
literally treat with my
Yeah.
hands. And then
Yep.
here's some exercises to reinforce that
Yep.
joint alignment and function, right? And keep it that simple.
Absolutely.
Yeah, awesome. Then my other question for you that kind of came out of your little background is, did you always think in your back of your head when you, well, I shouldn't say always, but once you started in your PT career and you did those few different types of settings and different things, did you think in your head, I'm going to have my own business someday? Or did that kind of just come more by necessity?
So I started being an entrepreneur when I was 12. So I always knew I was going to be an entrepreneur. It was so funny. I think back to, some of the stuff that I did, but I started my first business when I was 12, cleaning houses and washing windows.
Nice.
And from there, I made t-shirts. We had a company called Too Shy, Too Cute, my mom and I. That's what, they had that like puff paint that you could make.
Oh, yeah.
I just think about her and I would go to these shows and we would try to sell these shirts. And I love creating and developing. And I always said, like, as I, was kind of going into physical therapy, it's like one day I knew I was gonna own my own business. And I started Back to Normal it's actually, this year is 25 years. In 1998, I was kind of at that crossroad of, I'm either going to start my business or I was going to go back to osteopathic school, right? Because I was really, really interested in, in more, right, for my patients. And, and then I got onto the tour and the Back to Normal kind of got put on hold, but I knew one day that, I would open up a brick and mortar. And that's what I did after I left the tour.
Nice. And you're going on 15 years, 14 years since then?
Yep.
Your current practice?
Yep. Just about. Yep. I started and open up the location in 2010.
Yeah.
So we're at 13 years.
Yeah. Wow.
Yeah. Next year will be 14. Yeah. Brick and mortar for sure.
Yeah. Awesome. Well, thank you for sharing that. Very exciting. I love to hear your story, and a little more detail this time was kind of fun.
I know.
So can you give us 3 valuable tips that you've learned? Like, what are some of the things that you have found have had the biggest impact on you? I mean, when you were interviewing me, it was like, oh, I already know, like, I know your things, right? Because Lisa, for everybody, Lisa's been one of my main mentors as well, and really was kind of my, I don't know, inspiration or driver for going through Michigan State and really, looking at that correcting the spine first before anything else. That kind of drives the rest of the body, and you can't, if the spine's out of alignment, all that neuro stuff doesn't work anyway. So that has to be in there, or that, so some overlap with chiropractic there, and I appreciate that so much. So tell me, what are your 3, what you think are your 3 tips?
Okay, so for my first tip, it is for the clinicians that are out there, it is to be patient focused and not insurance driven. And that means, even if you have an insurance practice, you still can be patient focused, right? So the first is just to have your intention be focused on what is best for the patient, right? So, you're going to get the better outcomes if you're just really looking at what is best for them, not like, well, what's going to be covered by insurance. Okay. The other thing that I tell my staff, and I really try to do, is to be interested and not interesting. So really getting to know the patient, like what's really important to them and how can we help them achieve that? That is automatically going to help you get, great outcomes. And then I always say, if you've been listening to the podcast, you'll hear me say this over and over again. I say it when I'm teaching, when I've got, younger therapists, is take the time to do a good history. I say the mystery is in the history. If you ask the right questions and you take the time to listen to your patients, they will tell you what you need to know. And from there, you will be able to unfold a lot. I think oftentimes, practitioners don't have the time. They don't sit and ask the questions and they miss things. And so, Carl Steele, taught me about that, really asking the right questions and getting a thorough history. And then you put that together with your exam, and that's going to get you great outcomes. And then, showing the patient that you really, truly care, I think goes a long way. My favorite quote is by Maya Angelou, and the one that says, I've learned that people will forget what you've said. They'll forget what you did, but they'll never forget how you made them feel.
Mhm.
And I think about that all the time. Just showing them that you care is a big one. So that's kind of like, to me, all encompassed and really being focused on the patient and what's best for them. The next is a whole body approach. So I'm very big on, somebody comes in with, a shoulder problem. It's not just a shoulder problem. They're a whole human being. And there are so many things that can impact what is going on. So looking at the whole system, looking at their sleep, looking at nutrition. So with each new patient that we see, we do a heart rate variability comprehensive test that really shows us, do they have a high sympathetic load? What's kind of going on with their nervous system? We do an in-body body comp. What's their, fat to muscle ratio? Do we need to really work on increasing, muscle mass? What are the stressors? What are all the things that are impacting? And then just looking at the body, like the ankle could be affecting what's happening at the shoulder. So looking at the whole person and not getting like sidetracked. And unfortunately, in a lot of insurance models, therapists are limited because insurance is only going to cover the doctor prescribed just for the shoulder, and they can't look at anything else. And I just think it's doing our patients a disservice. And it's one of the reasons why I decided to go cash. It's like, I know everybody can't maybe afford cash, but I think your health is your biggest investment. And so I want to give patients what I feel they need to get well and to, treat the whole body. So, with the way that we've set up the practice, we're able to do that. And then the last one is to have a never ending growth mindset, right? And so for me, it was finding a good mentor, finding somebody who has the skill that you want, right? Whether it's in leadership, it's in manual therapy, it's in diagnostic ultrasound and dry needling, whatever it is, find a mentor, read everything they have, watch everything, take their courses, and, kind of immerse yourself with that person and learn from them and rinse and repeat. I did this with Darren Hardy a couple of years ago. I realized I needed better leadership skills. And I took everything he had. And for the last 2-3 years, I rinsed and repeated his courses. I listened to his daily, mentors. I did every course that he had, and I just kept repeating it over and over until I was like, okay, now I'm really embodying what he's saying, and I'm integrating it, and then teach it. Like whatever you're wanting to do, like that's what I did at Michigan State, right? I had mentors there. I repeated the courses multiple times, and then I wanted to teach because I knew if I was forced to teach, I was really going to learn, how to do it. So those are kind of, my three, I think, takeaways that has helped me, I think, over the years get really good outcomes.
Yeah, awesome. I think that mystery is in the history is such a true statement, and that's my big thing. And I think for me as well, that's probably the thing that the patient always comes back. Well, what exactly is it that you do? Because it's not really PT, right? And I've never had any doctor or anybody spend that much time asking me those things, right?
Yes.
And I just was filling out a questionnaire for an interview last night, and one of the questions on there was, what do you find most rewarding about your job or about what you do? And I said restoring hope, letting people feel
Yes.
like they're actually can
Yes.
get better,
That's
and
huge.
you do that by putting them at the center and asking those questions and getting to know them through their history, and you make them feel like, wow, I'm not important, I trust that you can help me, right? So
That is just, I say that all the time. And it's funny because last year we named all of our treatment rooms, and my room is named Hope.
yeah.
Yeah, because I feel like like that's a big thing that I just think people have just lost hope because they've been told, just live with it. You're getting older. This is just the way it's going to be. And granted, sometimes you have to make modifications because, there may be some things that you can't quite get 100%, but there's a lot you can do.
Yeah, you can improve quality of life no matter what the diagnosis, no matter what, the prognosis. So, yeah, that's awesome. And then the other thing is the growth mindset, I think, is huge too. And that's not always just learning new PT skills, as you said, that leadership, right? Or if you are a business owner, we're not taught business stuff in PT school. I mean, I think today they teach a little bit about that, but really, we didn't know anything about that. So that's one area for sure. And then and learning also multidisciplinary stuff, right? Like, you can learn from people that have a different skill set from you, a different profession from you, no matter what that is. So that's awesome and super valuable information.
Yeah, absolutely. And, getting to know people in your community, right? So you've got a good referral network to understand, like, what is functional. You and I talked about this on your podcast. What is functional medicine? How does functional medicine? What about regenerative medicine with, bone marrow and PRP? Like, educate yourself on all these different things, because you might not be what the patient needs. But if you have a good resource, they'll remember that, right? Because again, it goes back to the first point of, do what's best for the patient. Sometimes it's not you, and that's okay, right?
Yeah, absolutely. So next, I'll have you share one or two pieces of advice for our listeners that your audience have appreciated, right? So we just talked about the fact that you make them feel important, or how you make them feel. What are some other things that you think are, that other practitioners out there would like to be able to achieve, or how your audience or your patients make, feel about that?
So I would say this is something that I feel that I do well, and I really try to instill, in my team and keep at the forefront of my mind, but is to focus more on giving than receiving. Like, I want to think every single day, how do I bring value to myself, to my team, and to my clients, and to my community? So first, if you, I don't know if you've read the book, The Go-Giver. It's by Bob Berg and John Mann, and it's really great. It's a little small, easy read book. But it's really just about the power of giving. And when you focus on how to help others, so much comes back to you. So the first thing I would say is, for yourself, you should obviously invest the time in yourself. So I always say that, I learned this from Darren Hardy: invest at least 1% of your total income into continuing education for yourself. Whatever area that you're like, I really want to learn this, then invest in that every single, year. So you're constantly growing. And make sure that you're taking time for yourself. That is definitely something I'm trying to work on. I haven't been as good as always taking care of myself. So that is something, especially as an entrepreneur, we love to work, we love to create, and you do have to find that balance for you, yourself, and your family. And then if you're a leader, invest in your team. I feel strongly about, helping others. So find out what the people that you work with, what do they want, right? Whether it's professional development or something personally in their lives that they're really wanting, and help them get it, and invest back in them. And so for me, I really try to invest a lot that way. And then we talked about this, with giving to your clients. So find out what's important to them and help them achieve it. And then I'm big on, giving back to the community. We just got done with a big run event. It was a 3-day event that we did, and we had over 400 runners that came through. And it was just, this was our 6th year doing it. And just, things that you can do to help, in your community. I think, just give back, and, things will come back to you.
Yeah. And then the community knows who you are and what resources you have available to them, which also makes them trust you more, and then you can help more people, right? And provide that hope to a wider variety of people in your own neighborhood, which is so important. So
Yeah.
Awesome.
Yeah.
I love this. I having had not quite as big as your practice is now, but I had, 4 employees working with me from different disciplines. And then I had a couple of other practitioners that shared space in my clinic, but were independent businesses, but obviously we worked together a lot. And man, when I would get somebody new working with me, I would really spend the first couple of months getting to know them pretty well, and then what their skill set was, and then telling them, like, let's create the job you want. What is it that you want? You're part of the team now. It's not just my business. I couldn't stand if they called me boss, right? If I was my boss, I was like, no, I'm your colleague, right? Like, anyway, and that was always my thing. Like, let's take your skill set that you're really good at and make that into your niche, right? Or whatever that is. And, obviously you're still going to do whatever the patient needs, but let's make you kind of your own expert, so that each of them had an opportunity to shine. And that just added to the team environment and added to the offerings of the clinic, because we just could gel so much better and rely on each other and ask those questions. And that's another thing too, I think, that we learned working on the tour together. And I had that a little before that, being an athletic trainer, was, it's a whole team. So when somebody comes in and they need some help, you've got those resources right there. You know what? Let me just ask my colleague Lisa over here. Hey, Lisa, what do you think about this? Like, this is what they've got going on. And boy, do the patients love that, because they're like, wow, like, I'm like so important that you've got like 4 people, right?
Yes, I think that's so true. And I think, especially with younger therapists, and I put myself in this category because I used to be like this, like, you're afraid, right? To ask for help or to show the patient that you don't know something, right? When you're younger, you're more insecure. And as you get older, you realize, okay, I don't know everything. And I've got this whole big team, and this person is an expert in this. Let me pull this you know what? I don't know, but let me find out, or let me find somebody who can help you. Again, going back to what is best for the patient. It might not be us. But if I have all these resources and other great people around me, then we can find somebody that can help you. And patients really appreciate that, so being honest, clinically with ourselves, of maybe if something that maybe we don't know, and pulling somebody in, I think, who does, is hugely valuable.
Yeah. And as you say, you don't know everything. So you got to be honest about that. And now that I'm working by myself more, and just in terms of a clinical setting, I'm calling my colleagues, or I'm having coffee with somebody in town. And for me now, predominantly from other disciplines, but I've been slowly meeting the other PT clinics in town just to get to know kind of what their area of specialty is, so that if somebody has to be insurance based, I can send them there and feel confident about it. And then the other thing too is my Greenman book is like, it needs to be rebound for the second time, because that thing just goes with me, and I pull it out all the time. And same thing, visceral functional manipulation. I don't do that very often, so I pull that manual out when I need to use it. And I have I have laminated card with my craniosacral 10 steps, so that if I have to go back to that, I can remember exactly, so just that. And it's funny, and I don't ever have a patient like get freaked out that, oh, she doesn't know what she's doing, right? I think they're so much more appreciative, as we would be, that, oh, you want to make sure you do it right, so I think that matters.
Absolutely. Yeah, I totally agree. I'm constantly, doing that. As a matter of fact, I'm going back to Michigan State. Well, Kirsten and I are going to go do, she's one of my therapists who teaches visceral. And she's like, hey, I'm going to go take this listening class out in Albuquerque. She goes, you want to go with me? And I was like, you know what? I need to get better at the listening skills. So I'm going to do that. And then the week later, I'm going to do cranial 1 again at Michigan State, because it used to be Barb Reiner who taught. That's who I learned from. But now Lisa, Dr. DeStefano, is teaching. So it's going to be a different, twist to how it's done. And again, just refining those skills, going back to the basics, do the basics, get really good at that. So I'm excited.
Yeah, awesome. So is there anything else that you have to add that you think would be of value to the audience? Book, online,
I think, just surround yourself, with, people that are better than you. I've always done that. People that are smarter than me, or, have an expertise in something that I don't have. So they'll challenge you, right? Don't be afraid to be challenged, because, don't get complacent with just the status quo. Push yourself to keep growing, keep learning. And you do that when you have other high achievers around you, because they're going to push you, to be a high achiever as well. So I think that, that is just really important. I think too many clinicians just, they get, complacent with just doing the same thing over and over again. So if you surround yourself with, people that are pushing themselves, then, then it'll help you to do that as well. And the one thing I didn't really mention was Rehab Links, which is what this podcast was started for. So, when I was at Michigan State, I was teaching with Mark Bookout, and he was just a wonderful human being. And I will try not to cry, because we lost him this year. He was a good friend, and I had started Back to Normal with him, not Back to Normal, with Rehab Links. And, he was just an amazing clinician, and he taught me so much. And he had a long health struggle, and he passed in May this year. And I had started this, the podcast, because we wanted to get the message out about Rehab Links. And him and I started it back in 2013, when we were teaching the exercise course. And the course is really about how to marry what you're doing with your hands manually and giving the right and the best corrective exercise to get the best outcome. And we had this manual that everybody would just photocopy all the exercises. And I said, we need to put this in a system. And so we partnered with Physiotech, and him and I flew to Montreal, and we filmed all of our exercises. And so they were all in a system. And I think you were using it, and they're great, because, if I've got, an FRS or a sacral dysfunction, I could go in and go, okay, I've treated that. Now what's the best exercise to complement that? And then in 2020, we actually took the exercise course, put it online, and created lots of different resources. And so, anybody listening to the podcast, we'll put a link in, they can get a free trial of that home exercise program. If they're interested, you could maybe talk to, how you've used it. But it's been a great tool. My patients love it. They love having it right on their phone or on their computer, and it makes it much easier for me. It complements what I do manually with, the exercises. So, so I wanted to make sure that I mentioned that as well. And, we're getting, both myself and Galen and Kyle, who have taken over Bookout, seminars, are trying to carry on Mark's work as best we can. And so that's one of the ways that, we're doing it.
Yeah. Mark was an amazing teacher, and I was blessed to take a few classes with him back in the day. And Rehab Links too is awesome. So definitely everybody check that out. And I have used the Physiotech exercise program, I think since before you guys were on there, maybe right when you started on there. I think since 2012, around in there. And it's fantastic, and I love that that aspect of it, that module, the Rehab Links module, because so often I'll do some work, particularly if it's a spine or a back, and then in like what exercises, and they're kind of nuanced exercises. They're a little bit different than most of the stuff that you get for PT, and so trying to get a patient to remember how to do them, right? And so having that access to that is fantastic. And absolutely, the other cool thing about the program is, for me, right, like I closed my clinic and moved away, but I still do a lot of telehealth and occasionally go back to San Francisco to see clients there. And they'll call me, especially patients I've had for a long time, and they'll call me and be like, oh man, my foot's flared up. I feel like it's plantar fasciitis, I can do a little quick telehealth with them. And because I know them, I can be like, yep, I'm going to send you some exercises. And they know, they're familiar with that program. They know exactly how it is. And, you know, you can go in and modify your instructions on there. So it's a fantastic tool that really just adds a level of professionalism, I think, to what you to offer, because so many of those exercise programs out there are so janky. You know, they're just like, you know, and there's still PT clinics that are doing the old 3x5 card photocopying on a
Oh,
paper.
I know, or not giving people anything at all.
Right,
It used to be patients came in with a stack of
I
exercises.
know.
And then it's like, I don't know, over the last
Yeah.
like 5 years, they're like, oh no, my therapist didn't give me anything. And I'm like, what? I was like, they're like, yeah, they didn't give me any exercises. I was like,
Yeah.
okay. So
Yeah.
we
Yeah.
went from giving too many to not giving any. So
Right. Well, and you know, I mean, if nothing else, you can use your cell phone, and I'll do that with my patients. Sometimes I'll be like, I'll teach them a few of the exercises, and then sometimes they think, oh, can I film you doing that, right? Or I'll suggest it if it's somebody that really isn't getting it, or that they're not. A couple of my older patients are not tech savvy, and they don't want to go and look at this exercise program, and they don't know how to do it on their phone, but they know how to look at photos on their phone. Then I'll say, like, give me your phone, and we'll just take a little video, and you can go back. That's my dad. I record this video like in May, and every morning it's on he has a little checklist of things to do, you know, take his blood pressure and all this stuff. And one of them is Nadine's exercises, and he gets his phone and he goes to the exact spot in the house where I showed him how to do it. And he does his 5 minutes of exercises every day. But, you know, but yeah, that's that.
it works.
Yeah, and those visual cues in the video is just fantastic. So it's really a great program. And I haven't looked at your website in a while, so I need to get on there and see what's new. Awesome. Is there anything else that you think would be great for people to know or that you have to offer?
The only other thing that we do put in all the show notes, and I'd like to, you know, do a big shout out to Michigan State College of Osteopathic Medicine. They are sponsoring our podcast, and I very much appreciate that. And they're giving a 20% discount on any of the CME courses. So I would highly recommend, if you know you're a therapist and you're really looking to get great outcomes and take your manual skills to the next level, I would encourage you to do that. We do have a certification program through Michigan State, and myself and Logan Cooper are the chair. Mark and I had helped to start that certification program, and after he retired, Logan took over. And so you know, you go through a series of the courses, and then you sit for a practical and a written exam, and it, you know, again, really helps you to take those skills to the next level. But great program, and that gives you the opportunity, you know, to get a discount. So we'll put that in the show notes as well.
Yeah, I have to go back and see which class I want to take.
Yes, I'm doing
for that. Awesome. And Lisa, how can people find you? Where is your back to normal info?
Well, so they can find us at 2 places. So certainly at Back to Normal with a number 2, PT, P as in Paul, T as in Tom, like physical therapy.com is if you want to learn about our clinical practice at Back to Normal. And then for Rehab Links, for those of you who are, you know, self-learners who like online resources, I would check out Rehab Links with an S and then system.com. And that will
get 2 S's in that?
Yes, it's Rehab Links with an S and then system. So it's like a double S. Yeah. And we'll put that in the show notes as well. But and then you can go to I'm Back to Normal. Well, obviously we're on social. We do a lot on social media, Instagram, Facebook, YouTube. We got lots of videos. You can subscribe to our newsletter on Back to Normal. And yeah, so that's how you can find us.
Yeah, awesome. I get your newsletter, and I always like reading that every time it comes out. See what's new with you guys. And you're located in St. Petersburg, Florida.
I am.
So people that actually might want to see you in person.
That's right. I am in St. Pete. Yes, I do have people that come from all over. So, you know, St. Pete is a great place. So if you ever want to visit, stop in and say hi.
Awesome. Thank you, Lisa Chase. It was awesome to have you share your wisdom with us today.
Well, thank you for suggesting to do the interview. I think that was great. And this was a lot of fun. And until next time, let's you and I keep getting great outcomes. See ya.